Hi everybody, Jennifer Blevin-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about some insurance definitions. And I'm doing this because there is a lot of confusion with the insurance world and how they constantly are changing things. So I'm just going to do a very high-level overview of insurance definitions, and hopefully you can share this with your front desk staff if you have any new billers or coders that are still trying to get their feet wet and understand everything. And this will be a two-part series. I'm going to try to keep each part pretty short and sweet because they're going to be things that I really want people to remember and absorb, and that is going to be, I think, more productive if I do keep them short. So let's jump in and let's talk about some insurance terminology or definitions. So the first thing I want to talk about are the different insurance types. So there's insurance types when it comes to like a government insurance, and that would be like your Medicares, your Medicaids, your TRICARE, which is a military, or Tri-West, Tri-East kind of plans. And then you have your commercial plans. So your commercial plans are going to be like your Blue Cross Blue Shields, Aetnas, Cignas, United Healthcares, and probably some local commercial plans wherever you live. There are so many different insurance plans and carriers across the country, especially state to state. And then you have your national providers, like some of the ones that I just listed. The thing that you need to know is that those commercial payers can also hold Medicare plans, like Advantage plans, and also Medicaid MCO plans. So they might contract with your local state Medicaid program and offer more of an MCO managed care organization plan. So there's like plans within plans, and that's where things get really confusing. So it's really important where you live that your staff, especially ones dealing with insurance who are registering patients and billing patients, understand what's offered in your area and by whom. So Blue Cross Blue Shield might offer a Medicare Advantage plan in your area, but no Medicaid plan. But Aetna might offer Medicare Advantage and a Medicaid plan. And then you might have United Healthcare that doesn't offer any but a commercial plan. So those are the things that you really need to be aware of, because those people that are communicating with patients in your office and billing insurances need to understand those differences in order to collect the right information and do the right workflows that's required for their visits. So a Medicare Advantage plan is a Part C plan for Medicare, C as in Charlie. And Medicare patients can elect basically to pay a little bit more to have these plans, and they operate like a commercial plan. They usually have deductibles, co-pays, there's HMO plans, PPO plans, EPO plans. And these people want, I guess, a little bit more coverage and flexibility, so they're willing to pay a little bit more out of pocket than just their standard Medicare Part B coverage or Medicare Part B and a supplement. The supplement plans are another Medicare thing, and it supplements your Part B plans, the patient's Part B plan, and it's the secondary, the supplement plan, or Medigap plan, if you've heard of a Medigap. It helps fill in where that deductible is and just helps provide a little bit more financial stability and coverage for people who elect to keep Medicare Part B as their primary plan. A lot of confusion comes around Medicare Part C plans because people think that Medicare Part B is the primary and the Advantage plan is the secondary, like the supplement plan, and that's not true. The Medicare Part C plan basically replaces that Medicare Part B plan as the primary. So you don't bill Medicare directly at all, you only bill that insurance plan payer. So if it's through Blue Cross, Aetna, you bill them based on what's on the card, not Medicare Part B. And this gets really confusing. I have another video specifically about this, so I would check that out, because I see as that one of the biggest issues with my front desk staff is they get confused and they list Medicare Part B as the primary and the Medicare Advantage plan as the secondary, and that's not true, and things get kind of messy. So make sure that you understand that and you can train your front desk staff appropriately, and you can use my video if you want. So going back to commercial plans. Commercial plans have different types of plans within them. So you can have a PPO plan, which is a private payer organization, and this is where people get the most flexibility out of their plans. So this is where you have a deductible. They usually cost a little bit more premium wise, but there's no referrals needed. They can utilize in-network and out-of-network benefits, which we will talk about in the second part of this series, what that means. And they don't have to elect a primary care provider. So it's very flexible. They can go see a specialist whenever they want because they don't require referrals, and people will pay a little bit more for this flexibility and freedom. Then the biggest second one, or I guess they're kind of a toss-up depending on the area you live in, but HMOs. So that's a health maintenance organization and or health management organization. I've seen it both ways. And this is where most people who elect this coverage has to also elect a primary care doctor, because the primary care doctor is basically going to drive their care. So they won't be able to see a specialist outside of that HMO network without a referral. Well, actually, they can't see a specialist at all without a referral from their primary care, but they can't see anybody out of network at all to get it covered. So they have to only see in network with their HMO plan providers in order for anything to get paid. Sometimes they don't have deductibles, they only have co-insurances because it's a little bit more stringent and the primary care has to refer them to specialists. So they're the ones managing their care, if you can think of it that way. And it's way more strict. So people don't usually like that so much because they might want the freedom to be able to go and see whomever, but these are also usually a little bit more affordable for people when it comes to premiums. And like I said, a lot of them don't have deductibles. So that is intriguing when people are on a fixed income especially. And then you have some EPO plans, and I forget what that stands for, the acronym, but basically it's kind of a hybrid between the PPO and HMO plan where you can't use out of network, there is no out of network, but you don't have to elect a primary care, and sometimes, most of the time, you don't need a referral, but then it's on you to make sure that you're seeing participating providers in your coverage. So it can get a little messy there. And then there's some POS, and I forget what that stands for. It's not what you think, I promise you. But the POS plans are definitely something that is also seen, and you know, it's not as big of a deal to me because mostly it's PPO and HMO plans. Those are what people need to be looking for, and oftentimes it will say PPO or HMO on the card to help people when they are assisting patients to understand exactly what that plan is. Not always, but a lot of times payers are really good at putting that on there. And then that gives you kind of an insight of what you're working with or dealing with when you're trying to check benefits and eligibility. In part 2, we're going to go over what a deductible is, a co-insurance, a copay, in-network, out-of-network, and that all has to do with eligibility and benefits, and that's really important to understand. But first, in order to work on that part, you have to understand these terms, and that's the types of insurance that are out there and the different plans that could be offered to patients, because based off that is what's going to help you look up those eligibility and benefits. If you have any questions or comments, leave that in the comments below. Smash the thumbs up button if today's video was helpful, and subscribe to my channel if you haven't already. Thanks so much, you guys. We'll see you in part 2. Bye-bye.